Hey guys, it's Dr. Justin Marcagiani here. Hope everyone's having a fabulous day. Today we're going to be chatting about functional medicine gut testing, comparing it to conventional medicine kind of GI doc testing. I'm really excited to dive over that topic with you. We'll look at some of the different tests, the pros and cons, what each one is good for, and kind of my general recommendation. Before we do that, make sure you smash that like button. Really put a comment down below. Really want to know your thoughts on the content as well. Make sure you smash the bell so you get notifications of great content coming your way. All right, so let's dive in. So we have our conventional medical testing, and there's a lot of different things that could be done with more specific or unique situations. So I'm going to just give you kind of like what the most common testing is. And I see lots of patients who come in from conventional GI testing who are just told like they really can't be helped. They kind of fall under the radar of conventional medical testing. And we'll talk about why that is. We actually did a longer podcast today on that topic. We'll put the link down below so you guys can grab that full podcast as well so you can get more information. So the first thing is, what's the goal of conventional testing, right? Conventional medicine, allopathic medicine is disease-based medicine. They're trying to find, diagnose diseases. So you have diseases in the umbrella of IBD, irritable bowel diseases. This is like ulcerative colitis or Crohn's. These are very inflammatory conditions. A lot of times there's ulcerations. You may see ulcers associated with it. You may see fistulas, narrowing of the intestinal tract, bleeding, severe inflammation of the tissue, a lot of malabsorption, maybe blood, coughing up blood from ulcers in the stomach, or pooping out blood from ulcers lower in the colon area. And so these are all major areas of concern. So when we see irritable bowel disease, conventional medicine is really good at picking that up. Now, they may not get to the root cause of why that disease is there. They may give you some Lialda or mesalamine or methotrexate or an anti-inflammatory or a biologic, prednisone, to kind of put out the fire. That's usually going to be their approach. Maybe if there's blood, maybe they give you an acid blocker as well. It's kind of cookbook approach. Now, it may be necessary if the issue is very acute, right? Maybe necessary, but they're not going to get to the underlying issue. Now, there's a lot of people that fall in this in-between area. So if here is a functional medicine, if here's optimal health right here, and our goal in functional medicine is to bring people homeostatically back to optimal health, and if we have disease over here, this is where you have a diagnosed condition that it's there. It's palpable. You can see it. You can touch it. You can test for it. It's there. Crohn's, ulcerative colitis, ulceration, it's there. A lot of people exist in this interim. They're not quite here, right? That's why they're coming to see me, but they're not quite here. They've already seen the gastro doc and been told like, hey, you're probably okay. Or they're diagnosed with a disease of exclusion, or a diagnosis of exclusion like IBS, irritable bowel syndrome, where they've ruled out all of the other major inflammatory issues, and then they give you this diagnosis called IBS. Usually it's IBS-C for constipation or D for diarrhea. You could be somewhere in between, right? And they give you this diagnosis, say, hey, we've ruled everything out, but you have some symptoms, so we're going to throw it here. And typically, whatever those symptoms are, they're going to manage with medication. So antispasmodics, antidiarrheals, laxative for the constipation side, proton pump inhibitor for like dyspepsia symptoms, acid reflux, GERD. So they're kind of just spot treating and managing the symptoms of whatever that functional imbalance is. So they'll give you this IBS label, and that's it. They'll call it a day. You may be in between with like maybe a gastroparesis or some kind of gastritis, and they kind of say, okay, here's your PPI, here's your proton pump inhibitor, here's your omeprazole, and now what? You're kind of just like scratching your head, and because there's not a lot of holistic thought in, okay, what's the root cause? How did I get here? What food changes should I make? What supplement changes should I make? Should we go after and look for an infection? There's not a lot of thinking. It's just kind of like triage treatment to manage symptoms, and not deeper thinking of getting to the root cause. So this is where I come in. This is where functional medicine docs like myself come in. So when I look at a patient, we're looking at diet number one. What's your diet? Walk me through. I want to understand the history. How did you get here? What kind of stressors led up to this point? Walk me through hydration. Do you typically drink with food? What's your experience with ulcerations? Do you feel better with enzymes or acids? Do your stools float? Right? These are all really important questions that give me a lot of data. On the conventional medicine side, their history is going to they're going to want to understand how it all happened. They'll probably want to palpate, maybe auscultate, probably palpate to understand where the pain and tenderness is. A lot of times the person may be describing it off the get-go, right? Upper right-hand quadrant stuff could be gallbladder, could be liver stuff. More midline to left-sided rib could be a little bit more stomach, more belly button-ish, could be more intestine, and then the size of the abdomen and down low could be colon, especially the left would be more of the sigmoid colon. So you can kind of get an idea of where that inflamed tissue is. They may want to run a conventional blood test to look at RBC markers, ferritin, iron, to see if there's any low kind of anemic pattern happening from malabsorption. They may want to run a capsular endoscopy to look at inflammation. They may want to run if you have a more progressive functional medicine doc, they may want to run a fecal calprotectin, which is a good marker for inflammation. A lot of times they won't, though. They may want to run a barium swallow to see if there's an ulceration or some kind of a fistula or blockage. They may want to run an MRI or a CT scan if there's something else they want to visualize. And then most of the time they're going to recommend, if all those things pass, typically an endoscopy, which is scope down the mouth, or a colonoscopy or sigmoidoscopy, which is scope up the rectum to see if there's any lesions, polyps, ulcerations, inflamed tissue. You can add an itis to it, right? Microscopic colitis, gastritis. And they're going to visualize what's happening. Now, some may do a breath test. Now, I see hundreds of patients that come from gastroenterologists and they kind of have that check mark like, all right, they ruled stuff out. They didn't offer them much. Maybe they throw PPI at them. So I've seen docs, and most don't run breath testing. So breath testing is a better option. A lot of the conventional docs kind of pioneered by Dr. Pimentel have been doing this kind of testing more and has made it more acceptable on the conventional medical side to do it. So this could be a lactulose breath test that's looking for SIBO, whether it's methane or hydrogen gas increases, which tell us about bacterial overgrowth. It could be like a glucose breath test, which tells us more of a bacterial overgrowth in the stomach. It could be a urea breath test where elevations in CO2 are measured, which could tell us about H. pylori. They may run a stool test that may not be as comprehensive or using cutting-edge DNA technology like the testing that I typically use. And for the most part, that's going to be it. You may see a couple other little things here or there, but that's going to be the big stuff, maybe an ultrasound here or there, but that's it. Now, on my side of the fence, we're going to be looking at nutrition. We're going to be looking at diet. We'll be looking at supplements. We'll be running comprehensive tests that we'll be looking at calprotectin. A lot of GI docs don't, but some are doing that more. We'll look at immunoglobulin markers. We'll look at elastase to get a window into how enzyme production is from the pancreas. We'll also look at steatocrit, which is a marker for maldigested fat. We'll really look at the stool. Is there a lot of undigested food particles in the stool? Is the stool floating? If the stool is floating, that tells me that there's definitely a maldigestion of fat. We'll do the DNA testing to look for all the parasites. A lot of conventional docs are not going to be looking at candida or yeast overgrowth. So we'll run a stool test to look for different yeast. We'll also run a urinary test to look at bad bacterial metabolites, whether it's C. diff metabolites, whether it's dysbiotic overgrowth like benzoate or hippurate or 2,3-phenylacetate or indican. These are all really good markers. Indican also can mean more putrefied protein and poor protein digestion. We'll also look at the diarabinitol, like I mentioned, which tells us about more systemic yeast. We could also do H. pylori on the stool as well, which is helpful. We'll do also H. pylori on the breath if we need, or we'll do blood, or a lot of times the PCR is great. Now, conventional medicine may pick that up in a scope. They may do a blood, they may do a breath. Now, sometimes they can admit it can be a hit or miss. A lot of times they won't look at any of the virulence factors. VRD, OIPE, ISA, these tell us about FAGA, these tell us about the strength and the potentiation for the H. pylori to create more gut inflammation, cancers, ulceration. It helps to know that so you know what you're kind of dealing with. It's not the be-all or end-all, but it's just nice. They're typically not going to look at using any nutrients to calm down the gut lining, to calm things down. They're typically not going to recommend hydrochloric acid or enzymes. Now, hydrochloric acid, you definitely want to be very careful if you are using it with a potential ulceration, and we definitely do not want to do it with any active ulcers. But you'd be surprised with dyspepsia symptoms, a lot of times adding tiny amounts of acid in can actually relieve symptoms. You'd be surprised because you're lessening the acid from the rotting of the food. But you got to work with a doc on that, a good functional medicine doc. And when in doubt, do not use it if there's any active burning or irritation at first sign. It's probably not the right time. But at some time, we will want to use it as we heal the gut lining up. My analogy for patients is someone that needs to see a chiropractor or a massage therapist. They have a lot of back pain, but they just went out and got a sunburn. They need that adjustment. They need that massage, that myofascial release, but their tissue is just too inflamed to receive it. Same kind of thing with HCl in the gut. So I kind of tell my patients that as a good analogy. I think it resonates and hits home. So the comprehensive gut testing, and I have my 6 R's that I go through, and I kind of customize that for each person, right? We're removing the bad foods. Now, there's a lot of different dietary approaches: AIP, SED, low FODMAP, paleo, keto. We could do carnivore, right? We could do a low histamine. These are all different dietary approaches. I got a lot of tools in my tool belt. Number 2 is replacing enzymes, acids, maybe bile salts. Maybe we don't do any acids. Maybe it's bitters. Maybe it's lemon juice. Maybe it's ACV. Number 3, we're using gut healing nutrients. So my line, that could be GI Restore, which has a lot of the zinc carnosine in it. It has some L-glutamine, some DGL, some aloe, some okra, very helpful nutrition. Maybe bone broth. Third, we're repairing the gut lining, like I mentioned, but also repairing the hormones. Because your hormones, a lot of conventional docs, they give what? Prednisone, which is an anti-inflammatory. If we have a lot of chronic inflammation in our intestines, sometimes our adrenals are just very depleted and they're not helping bringing that good anti-inflammatory support to the table. Fourth, we go after the infections. Now, you can see it's fourth, not first. Most conventional docs, if they thought you had H. pylori or any gut infection, right on day 1, they're writing you a prescription for that. And it may not be the right time because we have to set the foundation with the immune system and better digestion and calming down the tissue so we don't have a major die-off or Herxheimer's. And then fifth, we're working on really high-quality, potent probiotics to really have a reinoculation, repopulation kind of phase. And again, these bacteria don't live forever. Maybe a month, they're transient. So we want to come back more periodically with this. And we want to try to get fermented foods back in our diet at some point so we can have good, beneficial bacteria coming in contact with our intestinal tract more frequently than just taking supplements. And then 6 hours retesting to really ensure that we've cleared the infection out. A big hidden vector for people getting reoccurring infections is a partner, and sometimes things can be spread via saliva, so it could be tricky. And then, of course, animals that lick, they could potentially pass infections too. So I just want to kind of compare and contrast one side. Conventional medicine may be good if it's more acute, definitely not getting to the root underlying issue. Functional medicine, really looking at everything holistically: stress, hydration, sleep, nutrition, supplementation, deeper lab testing, cutting edge lab testing, retesting, looking at peripheral people that could be passing on infections. These are all very important things to look at. So I hope I gave you all a lot to think about. And if you're working with a gastroenterologist, really make sure you get all the big things ruled out, and then go reach out to a really good functional medicine doc so you can dive in deeper to what the underlying issues. Make sure you walk away with that encounter feeling like you're getting to the root underlying issue. That's so important when you're trying to get yourself healed. And again, if you want to reach out to myself, I am available worldwide if you want to reach out as well. My link's down below. You can schedule. Make sure you subscribe to get great new content as well. And I have colleagues that I work with that can also help you out as well. So click down below. And if you enjoy this content, give me a comment, give me a share to friends or family that could really benefit from using it. All right, y'all. You guys have a phenomenal day. I got some Q&A here I'll dive into. Let's see what's up. Hey, Holly, hope you're doing good. Shifting. Oh, okay, we said the Voldemort word. We're going to have to just continue to... Yeah, it's the Voldemort word, so we're going to have to be careful of that due to technology that may be censoring. So we'll have to pass that one. Email my office, we'll hit it. Let me continue on YouTube. My chiropractor told me that cortisol causes inflammation. Is that true? Cortisol is a natural anti-inflammatory, but too much of it, chronically, it is catabolic and will break down tissue, and then eventually, chronically, if out of balance, can be inflammatory because it breaks tissue down. So yes and no. Acutely, it's very anti-inflammatory. We know that because of the cortisone injections we hear about athletes get, or a prednisone injection, right? So yes and no, it depends on the chronicity of that. Do you recommend long periodic fasting for cancer? I think it can be very helpful for sure. Fasting really benefits people that are, one, if you have a lot of insulin resistance, by not eating anything, you're not making insulin. So that helps correct a lot of insulin resistance fast. The problem is you're also not getting nutrients in your body. And number 3 is you actually want to be more, you want to lessen insulin by actually eating. So as long as you can kind of transition back onto a food template that works and keeps your insulin low, that's better. And then also, if you don't eat and you're eating a lot of foods that are inflammatory, it can actually make a lot of gut issues better because you're just not eating those foods. The question is, how do you transition back onto food, and how do you transition back onto a diet that keeps your insulin low without having to without having to fast all the time? That's really important. Okay. What's the next step for a terrible cough? 2-3 months, nebulizing, nasal rinse, NAC, ginger, diet, low carb. What test would you recommend? I'd look at the gut. I would look at the gut for sure. Great question. All right, let me keep on going here. Oh, Holly, just to answer your question discreetly here, the data is showing 20% of people with antibodies there would be a herd immunity response, but the data is showing that 88% of people with T-cell immunity are showing major benefits. So there's a T-cell, Th1 immune cell kind of memory that's happening, and these Th1 immune cells can actually mobilize antibodies really fast. So even if antibodies don't stay around, the Th1 T cells, natural killer and or helper cells, can actually mobilize those antibodies fast. So it's the Th1 immune cells. Take a look at my Justin Health Wellness Clinic page. I posted a study about this, I think, last Thursday. Take a look at that. Claudia writes in, just saw this press conference of the American doctors in the front lines. Okay, more Voldemort stuff. Can't talk about that. All right, let me keep on rolling back to YouTube. Seems the cough is getting better when moving around versus sitting down. Yeah, look at the gut. Could be food allergens. Look at the environment. I mean, if you have a moldy house or a moldy apartment, or you don't have a good air filter, those could all be big things. I mean, especially if you feel better when you're out of the home, then we definitely want to look at mold stuff, get the home tested, maybe get your urine tested for mold toxins, and also get a good high-quality air filter. Austin Air is my favorite. Health Mate Plus is really good. I like that one. There's a couple others that are really good, but those are my favorite. I've been on keto for 3 months. I supplement with 570 milligrams of magnesium every day, a mix of magnesium taurate, glycinate, malate, oxide. What's the daily max? Because you're going to have your bowels moving like crazy if you do too much. So that's a good indication. Certain ones you can go higher on, like taurate and glycinate and malate, because they're amino acid blends and they're just better absorbed. Okay. Someone has a parasite and it's continuing illness. Is there a way to slowly get rid of them without feeling terrible whilst doing so? Yes, do all the things that I talk about in my 6 R's, and then really make sure you're following my die-off reaction handout when you are addressing the 4th R. Lean into that, titrate up slowly, put things into the protocol as well, like ginger tea to help with the lymphatics, and then also adding in things like activated charcoal away from food and stuff can help bind things up. Great question. What do you feel about L-glutamine to heal leaky gut, and what dose? I mean, L-glutamine does not heal leaky gut. It's a powerful building block, but if someone has a parasite or a food allergen to gluten, could L-glutamine heal leaky gut? No. If you're doing it in conjunction with fixing all those other things, and then you're also doing it, then it's an important palliative part of the healing repair process. Wow, that's a tongue twister. A palliative part of the repair healing process. Okay, there you go. Sally sells seashells by the seashore, right? So L-glutamine, 1 teaspoon a day, 3 to 5 grams, 3 times a day is fine. If someone has a parasite and is continuing to illness, is there a way to slowly get rid of them and not feel terrible while doing so? Yes, you can. You can do that. I just answered that question. Is it true colloidal silver could help with cancer? What's your opinion on structured silver versus regular colloidal silver? So this is the problem with cancer, right? Because cancer has so many different causes. There is no one such thing as a cure. Like, you could get cancer because you're a young kid and you crawled around on your parents' lawn that was filled with glyphosate and pesticides every day. You could be someone with darker skin living in a northern climate that has very low vitamin D and high levels of insulin from too much carbohydrate. You could be someone that just has been on HRT hormones from horses like Premarin and Provera. You could be someone that maybe got a viral infection that morphed, right? So there are different causes to why cancer grows. Now, the most common, in my opinion, is going to be lifestyle causes. So a combination of low vitamin D, high levels of insulin from too much refined carbohydrate and grains, lots of stress, poor sleep, nutrient-deficient diet, lots of inflammation in their gut. All those things usually become the perfect storm. So anytime I hear about a cure of cancer, I'm just like, man, I just get a little bit skeptical because of the root causes have to be addressed. Now, I think the most promising like palliative therapy for cancer, I think would be more stem cell or more immune-based cancer therapies where they figure out which one of your immune cells tends to attack the cancer the best. And then they culture it, figure out which immune cell it is, and then they go back and they actually culture that immune cell, grow it, and then give it back to in an IV. That's probably the less toxic version. If you were to do a more natural chemotherapy, that would be the most promising version out there because then one, you're using your own cells. Number two, it's targeted and specific. And number three, you're giving it back to yourself in a more concentrated fashion. So I like those kind of therapies, still not root cause. So when you're dealing with cancer, you always have to say, am I addressing the root cause, yes or no? And then if I'm using something palliative, do I know it works? Like, have I tested it against my cancer cells? And number two is, what's the toxicity profile? How much will it damage me in the process? You want to look at both of those sides of the fence when you're dealing with cancer. What's the reason for cutting out rice in case of autoimmune issue? So rice has a protein called horsinin in it, which is very similar to gluten. So if you're very sensitive on the autoimmune side, you could cross-react. Your immune system could cross-react, just like your friend may be able to see the family resemblance in your cousin to you. Your immune system may be able to see that same family resemblance with rice to gluten or gliadin, right? Horsinin's the protein, the prolamine protein in rice. Gliadin's the prolamine protein in gluten. Okay, great. If someone is in the hospital, how do you ask or demand for the protocols that you have worked with? That is very tough. That's really tough. I don't have an answer for that one outside of if someone's in the hospital, do your best to bring things in that you can do orally and or via food. That's your best bet. If someone's in the hospital that you know of, definitely just try to bring in bone broth, green juice, things that are really easy to digest, crock pot meals, not big, thick meals, because usually if they're in the hospital, they may be on medications that have side effects. They may have a lot of nausea, indigestion. Maybe they were on anesthesia for a surgery and their gut may not be working well. So really good nutrient-dense bone broth, soups, stews, high-quality green juice, celery juice, all low-sugar stuff, low sugar. Hope that helps. Okay, great. Recently heard in a Netflix show that carbs are good for you and meat and poultry is the main cause of heart disease. Who do we believe since there is so much contradicting info out there? Yeah, that's the Game Changers podcast. I won't go into it too much. Just go look at Chris Kresser's conversation on the Joe Rogan podcast. I think it was back in October, November 2019. Go take a look at it. But in general, old foods do not cause new disease. We've been eating animal products and high quality fats like that for tens of thousands of years, maybe longer, hundreds of thousands of years, okay? So my first BS detector is old foods don't cause new disease. So when people tell me this food causes this, I'm like, yeah, no, it's been around for hundreds of thousands of years. Now, the Neolithic foods that I think are going to be causing disease are going to be a lot of refined processed vegetable oils because the extraction process is Neolithic, it's new, and it damages the fats and creates a lot of oxidation and free radicals. Excess refined sugar and carbohydrates are going to be a major problem. Trans fats are going to be a major problem. And then, of course, just consuming too much carbohydrates for your metabolic type, right? Too much carbs, even healthier fruits and stuff. There's some nutrients there, but it may be too much for you if you're sitting all day versus exercising. So you have to kind of balance out what your metabolic needs are per your macronutrients. But the BS detector is old foods don't cause new disease. Then after that, it's just dialing in your macros for your kind of metabolic biochemistry. Great questions. Any keto guidelines for menstruating women? Keto seems to be disrupting my cycle in some cases. So as long as fats are adequate and proteins are really good, you could just try to add in a little bit more carbohydrates at a time. So if you're noticing that your diet's great, good proteins, good fats, good anti-inflammatory nutrients, you can just kind of taper up. You can just kind of taper up a little bit of those good quality carbohydrates. You can choose some zucchini at night, maybe a little bit of squash, sweet potato. Start with a kind of a palm serving and see how you feel. And if that really starts to improve your energy, that's a really good sign. If your cycle starts to stabilize, that's a good sign too. Oh, great. Glad the sound is good. I figured out what the issue is. The new update of Skype, it auto-adjusts my mic, and it's just Figured it out though. Got it. Thanks for the feedback there. How much time is it safe to use aloe vera for gastritis? I'm fine with a couple of months as long as you're getting the root underlying issue fixed and you're changing your diet and you're making good changes with your food and digestion. That's usually enough, but taking healing nutrients like that, usually you can do it chronically without a problem, but a few months is fine. In my line, typically we're doing it, anywhere between 1 to 3 months. Can eating too much sweet potato cause vitamin A toxicity? Well, remember, sweet potato does not have vitamin A. It has beta carotene, and beta carotene gets converted to vitamin A. So if you do too much sweet potato or squash or orange kind of bioflavonoids, you'll notice a lot more orange deposits in the skin calluses on your hands or feet. Also, low thyroid can cause that too because you need thyroid hormone to make that conversion for beta carotene to vitamin A. So in general, that's a pretty good sign. But in general, I think a serving or 2 a day is fine, but keep an eye on that. What are some symptoms for stomach cancer that are red flags? So big stomach cancer symptoms are going to be just, blood loss from an ulceration, right? Ulceration, chronic gastritis. Now, most people, they're going to get a scope. They're going to know what's going on. You can still have gastritis, not have any cancer. As the tissue as you start to see dysplasia and metaplasia, the tissue starts transforming. Usually you see the squamous tissue in the stomach. It starts converting to thicker columnar tissue. It's almost like your stomach's getting a callus. And you can see dysplasia / metaplasia, the transformation of the cells into a more carcinogenic cell. Inflammation is the breeding ground for that. So just get the inflammation under control. You can use things like calprotectin to monitor. And then as long as you're not losing blood, that's a good sign while you get to the root underlying issue. So calprotectin is a pretty good measure, at least in the meantime, while you fix food, go after the infection, etc. How can I protect myself from contracting Pasteurella from pet dogs? Pasteurella is a bad bacteria that's transmitted by bites, ticks, and scratches. How is it spread in dogs? I'm not sure. Is it a bite or is it a lick? I'm not sure. Dr. J, is it understood why gluten is causing new issues, although it's old food? Well, not really. So through the genetic modification process, the chromosomes have changed in gluten significantly. So if you go look at Dr. William Davis's book, he talks about einkorn wheat. And then einkorn wheat was, I think, 50-something chromosomes, and then it shifted to this newer type of chromosome wheat. And the gluten content is higher. And then also the glyphosate that a lot of these foods carry have made the guts also more permeable. Now, most people, when we consumed, grains more prehistorically or just kind of evolutionarily over many, many hundreds of years, usually sourdough and usually a lot of soaking and fermentation tended to be used, which really helped decrease a lot of the anti-nutrients and improve the bioavailability of those proteins and amino acids. So that's definitely shifted, and the genetic modification process has really made the guts more sensitive regarding gut permeability, and thus those proteins getting into the bloodstream affecting the immune response. So transmitting through ticks, and bite licks, I'm not sure about that, but you can always just give your dog a nice cedar oil bath to knock out any of those infections. Cedar oil is a really good oil that has anti-tick qualities to it. And then you can get something called Wondercide. Just really, if you know your dog's going to be out playing in the backyard, you can really just spray that area down with some good cedar oil, some good essential oils, and that will really tend to repel a lot of ticks and fleas from your area. That's probably the best advice I could say there. All right, guys, any other questions at all? Feel free to let me know. I really enjoyed today's chat. Hope I gave you some good insight back and forth. And again, you got to look at where conventional medicine shines, and you got to know where it's good, and then you got to know where its shortcomings are, and then you always have to ask yourself, am I getting to the root cause? Conventional medicine assumes that there is no root cause, right? Triage medicine, which is what conventional medicine is based off of, it's all triage, right? It's all battlefield medicine, is the underlying cause is that guy got hit by a grenade or a bullet. There is no perpetual issue that's repeating itself, right? So the assumption is it's a one-off every time in conventional medicine world. So you just manage, you just triage, you just bandage up, and we're good. But we know with chronic disease issues, it's not that simple. The underlying cause is not addressed. So while you may triage is okay, you just have to not use those triage modalities longer term and preventing and thinking that you're fixing anything. Okay, great. Are some forms of dairy like butter and ghee and cheese okay on an autoimmune template? So I always tell patients no dairy in the beginning, but we'll add back in egg yolks first, then eggs second, because of the rancidification of the whites and the avidin in there can be a problem. And then with the butter, we go with ghee first because ghee is a lower level of lactose and a lower level of casein. Butter, albeit, is very low in lactose and casein, but ghee is like the ultimate. And then if you do good with ghee, then you can add butter back in, like a good quality Kerrygold. And then if that's good, then more than likely butter and ghee is fine because of its lactose content and casein content are low enough. Any thoughts on arm or hand feeling a bit numb after walking? I mean, I'd need to know a lot more, but there's probably a structural mechanism going on there unless you have an underlying peripheral neuropathy from diabetes or high blood sugar or a B12 deficiency, probably a subscap issue. That's the most common one I saw in chiropractic. This muscle underneath here really can get tight and kind of pinch some of those nerves going down the arm. Very possible. All right, excellent, guys. Phenomenal chatting with you. Have an excellent day. Share, subscribe, comments down below. Really appreciate it. Take care. Bye.